So good afternoon. I'm Carolyn Vermont, CEO for Habitat for Humanity of Coastal Fairfield County. Thank you for taking the time out of your busy schedule to join us this afternoon. I realize that some of you are on your lunch break, but do stay present on the screen if at all possible. As we move forward with today's presentation, please place your questions in the chat feature. Dr. Rodriguez will answer questions after her presentation, time permitting. A little bit about Habitat. So Habitat for Humanity of Coastal Fairfield County seeks to build community and improve lives by partnering with low-income working families, volunteers, and donors to build decent and affordable homes in stable and welcoming neighborhoods. At Habitat for Humanity of Coastal Fairfield County, we are committed to creating a culture where diversity, equity, and inclusion are central to our mission. We have dedicated 286 homes since our inception in 1985. And so we are really excited today to celebrate Hispanic Heritage Month on the last day. Every day is Hispanic Heritage Day, but for the recognition from September 15th to October 15th, we like to celebrate it each year at Habitat, and we're so happy that you're here to be part of that with us. Hispanic Heritage Month is a time to recognize and celebrate the many contributions, diverse cultures, and extensive histories of the American Latino community. As part of President Biden's National Hispanic Heritage Month proclamation, he stated that my administration is committed to putting the American dream within reach of every person, and it is working. We have created nearly 16 million jobs since we took office and have seen record low unemployment among Latinos. And Latino entrepreneurs have started new businesses at the fastest rate in over 25 years. We have more than doubled Small Business Administration loans to Latino-owned businesses. We have invested a record more than $15 billion in Hispanic-serving colleges and universities. And we have approved the cancellation of student debt, a burden that disproportionately falls on Latino borrowers, for almost 5 million people through various actions. We also cracked down on bias in the home appraisal process, so homes owned by Latinos and those in majority Latino neighborhoods can be valued fairly. Thank you, President Biden. And so at this time, I'd like to introduce our presenter. Dr. Rivera Rodriguez was born and raised in Bridgeport, Connecticut, and continues to give back to her community. She has dedicated over 30 years of her professional career to nursing and public health, both within the nonprofit and profit sectors. For the last 10 years, she has been a leader in healthcare administration, development, and management. She was appointed on October 30th, 2023, as the Director of Health and Social Services for the City of Bridgeport, the largest city in the state of Connecticut. She manages, leads, and supervises a multidisciplinary team and manages critical projects to carry out the vision of the Mayor of Bridgeport. She is responsible for all financial, programmatic, and managerial aspects of an urban health department that is comprised of key divisions, including health administration, environmental health, family health, and wellness clinic, public health emergency preparedness, social services, and other key divisions. Prior to joining the City of Bridgeport, Dr. Rivera Rodriguez was the Chief Operating Officer of a federally qualified health center in Connecticut, the largest health center in Fairfield County. She has a public health and clinical expertise cemented during the rise from registered nurse to Chief Operating Officer and now Director of Public Health and Social Services. She holds a Doctor of Nursing Practice from Walden University, a Master of Science in Nursing Education from the University of Phoenix, a Master of Public Health from Southern Connecticut State University, and is board certified as an advanced public health nurse and in national healthcare disaster. She has been has been a registered nurse for over 30 years and has worked in several different healthcare settings. She has taught in universities and colleges and has worked in corporate America. Dr. Rivera Rodriguez is a member of Sigma Theta Tau International Honor Society of Nursing, Phi Nu Chapter American Colleges of Healthcare Executives, and American Organization of Nurse Leadership. Please join me in welcoming Dr. Rivera Rodriguez.
Thank you. Listening to you say that, if anybody would have told me 30 years ago that I would be sitting here today, I'd be like, no, I didn't have that idea, that aspiration. I was born on the east side of Bridgeport. And so Bridgeport has been my home my entire life, as well as my career for the most part, other than going away in college. And I am a first generation college student, which for my parents, that was big. They were both from Puerto Rico and they value education as the key component. I remember when I graduated nursing school, my dad said to me, and it has always been my touchstone for me, because I didn't have mentors or anyone to say to me, you're going to go very far, right? There wasn't that many out there. But my father had said something to me that has stuck with me my entire career. And he basically said, they can take your house, they can take your car, you can lose your job. But what no one will ever take away from you is your education. And with your education, even if you have to clean toilets for a little while, you will get back to where you needed to go based on your education. And that's true. And so, looking at my career and the trajectory that I went into, and now coming here to the city of Bridgeport as their health director, really is full circle. Because when I was a young little girl as well, the health department always had a clinic many, many years ago. And we used to call it Model City, for anyone who remembers back in the day, the clinic. And so we use the services of the city of Bridgeport for some of our clinics and dental and stuff of that nature. And so, when I went to college, I didn't have role models. I didn't have anyone to say to me, you can go further than your dreams can put you to, right? And I learned over the years that if I had no one to tell me how I can make it and why I should make it, I wanted to be that for others. And so with my career, I'm very proud to say that along the lines, I've always had the desire to be that model and role model for others who wanted to aspire to do that. And I'm fortunate enough to do that with Bridgeport Caribe youth, right? Speaking to them about how is it that you want to go to college, what to do when you go to college, what to look for when you go to college. Because at the end of the day, if you really want something and it's in your heart and it's your dream to do, you'll do it. And as Ms. Vermont said, we have student loans and they have positive and negative things to them, right? But I think for all of us, especially those that live in Bridgeport, we are a large urban city. And a lot of people seem to think that a lot of good things don't come out of Bridgeport, but I beg to differ. We have a lot of great things coming out of Bridgeport. We're making a lot of strides and changing and building in businesses and bringing in housing, which is a big thing. I grew up in the East Side where Boca and Bass Pro is today. And so my son loves Bass Pro because he's like, that's the guy store. And I see that 20, 30 years later, where we are and how the city is trying to move us forward is very inspiring. And to be a part of that is also phenomenal. When I became the chief operations officer for Optimus Healthcare, I was actually their first Latina to be that. And I was actually their first chief nursing officer in the organization. And that spoke a lot to me because, coming from Bridgeport and looking at where our children are today and letting them see that you can get further than you imagined is something that I take with me every day. And I really enjoy that because when you look at Bridgeport, you see a lot of construction, hopefully, going around. but we still face a housing issue. We still have a crisis for housing. And housing plays a big pivotal role in all of our lives. As families, as children, we want to be able to go home and go place to sleep and be comfortable, do our homework after school, right? And there are sometimes issues where either financially our families are struggling and can't afford to either pay the rent, or is it the rent, or am I buying groceries today? And so being part of a community within the city of Bridgeport, of having not only the health department, but partners. I see Bridgeport Hospital as our partner. Habitat for Humanity is a partner. I've known people in my life that have also applied and were accepted to build their home under Habitat for Humanity. And that's awesome, right? Because it gives them a safe structure to be in. What many people may not be aware of, that with housing, it does impact not only our physical environment, it impacts our health, it also impacts our mental health. And so, you know, when someone is facing the crises of losing their home, whether they're renting or own it, that plays a big piece, right? Because you're wondering, where am I going to be with my family? How am I going to survive? What can I do? And knowing that, you know, 211 is a phone call away. The health department is a phone call away. The hospital, Habitat, a lot of community alliance, you know, partnerships, they are there to help serve our community. And I'm very proud to be part of that infrastructure, because when I look at my health department, we have multiple divisions here. And one of the ones that I'm really passionate about is our housing code enforcement division. And what that means is anyone within the city of Bridgeport, if you are renting a home or an apartment and you feel that there might be issues within your apartment, you know, you can have a leaky ceiling, you can probably have some mold, you can probably have an infestation, unfortunately, of roaches or of mice, right? Because wherever there's construction and you move the ground and you kind of disturb the normal environment, it's gonna like release things into the air or into the society, right? And so having our housing division here as a tool and as a resource for this community is important, because everyone is entitled to a safe, clean environment to live in. And, you know, one of the key initiatives that I have here in the health department is to make sure that the community realizes that, you know, when you speak to your landlord and you say, hey, I have this issue, I have a leaky faucet, I have mold in my bathroom, I feel there's something wrong, that landlord should take every mechanism to repair. If not, the health department is here to help you. Because again, we have had studies that show that people who have a safe environment learn better, have better family dynamics, right? I'm a product of that. We grew up in a 6-family apartment building on the east side. It's still there, actually, very surprisingly enough, it's still there. And it was all multifamily, especially on the east side. Very few single-family homes, but it was mainly more multifamily. And as people come and go, you also have documented and undocumented individuals that now come and seek refuge within the city. And so sometimes you have overcrowding. And that's not good for individuals as well, because you want to be able to come home and relax, but people have to understand that they may not be able to have access to affordable housing. And so living within family members might be an option. But again, we want to try to control our environment, because there's something called social determinants of health within public health. And one of the things that we strive as a community is also access to care. And access to care is basically, do we have transportation to get to our appointments? A lot of us know on the east side, we have the bus stops, we have the train stations, we now have Uber, right? But not everybody might have access to Uber. So how can we ensure that people have access to healthcare? How can we ensure that if somebody calls looking for a doctor's appointment, they're able to get in? And it's, again, building that relationship. And as the health director, I'm very, very proud to say, you know, I worked at Optimus Healthcare. They're a phenomenal partner. I've also worked with Southwest Community Health Center, which is our other federally qualified health center on the west side. And they do serve our population, and they have a lot of resources. They provide primary care, pediatrics, women's health, behavioral health services. which we have identified during COVID, that is a big, big area of need, right? And so as a health department, I cannot solve everyone's problems, but I want to be able to be a hub. Our social services department should be a hub, should be someplace that if someone makes a phone call, if we can't solve that problem, we're going to align with our community partners to be able to do that for them, right? And so I never want to have everybody walk away and say we did nothing for them. Even if it's just a phone call to Miss Vermont and say, hey, what's the application process? I know someone who's interested in wanting to get a home and they can't afford it. What does it mean? It's able to pick up that phone call and have her say, hey, find it online, call this number, do this, do that, and give that person an answer. It's always being able to afford someone an answer, not walking away saying, oh, nobody helped me. Why is it that nobody helped me? Is it because I can't afford it? Is it because I'm a minority? It shouldn't matter who we are. We are all individuals. We are all here for a purpose, and we are all here to enjoy the city of Bridgeport, which if you look around, like I said earlier, we're building so much. We're building housing. We have wonderful parks. We are known for our parks in this city. Years ago, Seaside Park, the Lighthouse, everyone knows it. We have Beardsley Park. We have areas where people can start walking. And walking is great for your health as well, right? We have bike trails within the city. You might see them on the road where bikes can begin and form exercising, and everything comes back to your health and your wellness. Because when you take care of yourself, not only are you physically happy, you're mentally happy. People say to me, you know, I love coffee. Coffee makes my day, right? But walking outside and getting some fresh air and just taking a look around the downtown area, it is amazing what this city has done in the last 10 years in the downtown Bridgeport area, right? You have housing, you have the old Reed's building is converted into an apartment house. Our old mall, which is now Housatonic Community, College. It is amazing what we've been able to repurpose our buildings for, which at the end of the day allows everyone that comes in here to experience that. Talking a little about Housatonic, right? Maybe people say, I can't afford college. You can afford 2 years of community college. Usually what I tell a lot of people, if you can't afford a 4-year degree, that's okay. Do a 2-year, get an associate's degree. And then with that associate's degree, you can apply to a 4-year college and in 2 years come out with a bachelor's degree. There's always, always another way to find that dream that you want to get done. I knew by the age of 10 that I wanted to be a nurse. I didn't know how I was going to pay for it because my dad was a custodian back in the day and my mom worked in a factory. We didn't have a lot of money. No one told me about student loans and what it means. All I knew was that I wanted to take care of babies. I wanted to be a maternity nurse, and that's what I ended up being, right? And I went to college and I worked full-time and went to school full-time. I don't suggest anyone do that because you can't do that anymore today. But, for me, the dream was so big that I was afraid to tell people because I didn't want anyone to tell me that I couldn't do it. And so I worked. And when I decided to pursue my additional degrees of master's in nursing and a master's in public health, as well as my doctorate degree, my husband supported that vision for me and that dream, right? Because I knew that I had a purpose somewhere. I just didn't know what it was going to be, but I always knew that my gift was serving. How it was going to be, I wasn't sure until October of 2023, when I applied as the city's health director. And I said to myself, wow, you know what? I can make a difference because I still lived in this city. I still have my parents in this city. I have family and friends in this city. And I said, how can I do that? How can I give back to my community? And so coming into this health department and really seeing all the services that we can provide and in the future also bring in to provide with partnerships, I was really, really excited because as I mentioned earlier, We used the health department clinic when I was a young child. We used the dental clinic back then. The city of Bridgeport had a dental clinic. We had a hygiene that now is over at Fones School of Dental Hygiene at UV. We had one of the first dental hygiene course classes here in the city of Bridgeport. And so we've always had a first of something. And being able to bring my relationships, because I was full-time faculty at the University of Bridgeport. I've also taught at Southern and Fairfield U and Sacred Heart. Having that affiliation has also helped me say, how can I bring that academic relationship to the city? How can I begin to have people fall in love with public health? Because this isn't a job for everyone. This is a career that you really want to serve your community, because it's all about service, right? The way of nursing is service. Anywhere I walk in, it's like, okay, how can I improve this? How can I make this better? I look at my housing department and code enforcement, and I want to make sure that everybody has a safe place to sleep. I look at my environmental health department. You know, we regulate and license a lot of food establishments, barbershops, tattoo places, right? All to ensure that it is clean, sanitary, and safe for anyone that walks in. That's being a servant. That's making sure that the health and wellness of this community is at the forefront for everyone here working in the city. And, you know, when we think about Bridgeport, we do have high asthma rates, but again, it's because we are near I-95, we're near the train stations, which unfortunately does impact our environment. We also have homes that were built before 1978 that has the risk of lead. We have a phenomenal lead department, lead prevention program here as well, that children under the age of 6 have to get tested for lead. And if it's positive, we are notified as the health department, and I have inspectors go out there and they inspect those apartments. If those apartments or homes need to be remediated, we have assistance. We have the Department of Public Health lead program also has funding to help abate for lead, right? So everything ties in from a health perspective. Even though people hear health, we're not all about medical, because we're not here in the service of medicine. We're here to take care of the public's health. And the public's health is really environmental. It's more about making sure that our homes are lead-free. It's making sure that our neighborhoods are safe, where we can walk around during the day, where we not have to worry about, you know, broken sidewalks or streets that are pose a risk or anything of that nature. We see a lot of police presence within our neighborhoods, paroling the area. You've probably even seen me a couple of times on Facebook talking about syringes that show up on the park, because unfortunately, we do have individuals who have substance abuse issues, but it's educating the community how to be careful if you come across needles, how to dispose of needles the correct way. I just did a presentation on it last week with Frank Recchia and Liberations Program. You know, they're a phenomenal partner here within the city, because again, the health department is not here by ourselves. We are part of the fabric of the city of Bridgeport, and we are part of all the services that provide the city. We're not just one entity, because again, we can't be everything to everyone. And so building those relationships is a key factor for me, especially when I use the services back when we were growing up, right? So I know that there are partners out there that are just as invested for the city of Bridgeport and surrounding towns. It's not just Bridgeport, but I just happen to have a love of Bridgeport because this is who I am. I walk down the street sometimes and I run into old friends from high school and they're like, hey, what are you doing here? And I'm like, oh, I work here. They're like, what do you do? And I'm like, well, I'm the health director. They're like, what? You got to this place? And I'm like, yeah. And if I can do it, anyone can do it, right? As long as you have that dream and that desire to do what you need to do, kudos to us, right? And in this month of Hispanic heritage, I'm proud to be one of the Latinas that can say, I made it. How I got here, I don't know. It's by the grace of God that I got here. And I'm proud to sit here. And if I can help anyone fulfill their dreams and be that model to say, hey, I grew up on Nichols and Pembroke Street. That's where I grew up. Nichols Street and Pembroke, which used to be the old exit 28 north, southbound. Now we just have it northbound. But I go by there every once in a while and I look at where I started from and I look at where I am today. And I'm teaching my son those values of, you know what? I have to give back to my community because my community got me where I am today. I had friends, I had family that said, do it. Hey, talk to this person. Maybe you might be good at this and you might be good at that. I had some phenomenal teachers when I was at Harding High School and I did Catholic school undergrad and stuff like that. But for me, being a registered nurse is always my big thing because that's my area of service. And I bring that always to everything that I do. And as the director of health, you know, it's health and social services. And so I still utilize a lot of that nursing component, but I bring the business mentality of how can I serve my community? How can we bring in partnerships? How can I collaborate with others to help move our city forward, right? And so that's one of my visions, and that's hopefully what I want to do in the next 5 or 10 years that I'm here. I'm not going anywhere unless someone tells me I got to go. But, you know, I think that with this Hispanic Heritage Month, they had an event on Friday, which I'm so bummed that I missed, but I had to be with my parents to watch the children celebrate who they are, watch the adults celebrate who they are as well. I was able to participate the first night of Hispanic Heritage Month at City Council, where I think it was 6 to 6 came in, the students brought in the flags. It was phenomenal to watch these children in their costumes of their country that they came from and show this pride of who they are. And I want to continue to see that in our children, right? And so partnering with the Board of Ed, partnering with community or organizations, how can we get the message out there that we live in a phenomenal city? We live in an area that has so much potential, and how can we contribute to it, right? So for me, my charge, and please tell me, Ms. Vermont, how much time I have left, to say that the health department is here for everyone. You know, we are responsible. We have a social services department. We have a crisis intervention team. We have social workers that actually work with the police department on some behavioral health calls. We have the Fair Rent Commission. If any individual feels that their rent might have been skyrocketed to the point where they can't afford it, there is an option to speak to someone about that. We do have fair housing as well. We have our clinic, which we are going to start we are providing services. We take care of a lot of the undocumented refugee people that come in for tuberculosis and other medical conditions, and those that we cannot treat, we send out to the community health centers, or we send to Bridgeport Hospital or St. or Hartford Healthcare, right? Because again, there's that relationship. If we can't provide a service, we're going to find somebody in the community who can do it, right? Because at the end of the day, that's what this is about. It's building that pipeline. It's building that infrastructure for our community to be able to have a safe neighborhood, a beautiful neighborhood, you know, have some trees growing in the backyard, have some plants growing. We have some wonderful community gardens as well. We have our farmers market that ends actually tomorrow. From our farmers market, where we have local farmers that come and have grown their own fruits and vegetables, because in the city of Bridgeport, we were known as a food desert, meaning we really didn't have a lot of access to fresh fruits and vegetables. And we're trying to change that. We're trying to have the community gardens grow their own piece. We're trying to get children to be interested in what does it mean to cultivate and grow and cook your own food, right? It's all about education. And that's what I'm proud of in this health department. You know, making a phone call to say, hey, I want to partner. Can we do something together? I see Martha Judd was on the Zoom. Same thing. She does a lot of community events that she lets us know about. We let her know about. It's that partnership. We have the partnership with Hartford Healthcare. A lot of things that they promote, we promote for them, right? And so it's building our community, because that's who we are. We are a community. Irregardless if you're a Latino, African American, Asian, it's all about community. It's just that this month We're highlighting the Hispanics within the city and who we are and how diverse we are. As you mentioned, Ms. Vermont, right? It's all about inclusivity. It's all about diversity, because we come in a lot of different colors, a lot. A lot of people see me with red hair and freckles and they don't think I'm Puerto Rican, because they're like, Puerto Rican, you have red hair and freckles. We have red hair, freckles, blue-eyed, blonde-haired people. It doesn't matter. We are a melting pot of everything that we have within the Caribbean. And so, you know, I am honored to be a part of this. I'm happy that Ms. Vermont allowed this conversation to occur. And if there's any questions in the chat box, if we have time, I'm happy to answer whatever questions. I have to put my cheaters on because aging gracefully, right? I'm aging gracefully. You're on mute.
Okay, I'm glad you saw my lips moving. Thank you so much, Dr. Rodriguez. And we do have some questions. Couple of things. You said you missed the Hispanic celebration on Friday, Hispanic Heritage Month. So I attended. It was beautiful. We have Tatiana on here today and her youth group. They did a great job performing. So it was really nice. It was really nice. Sorry you missed it. But it was a great celebration for Hispanic Heritage Month. I'll ask the first question. So decades ago, when I worked for the health department, part of my job was educating residents on the east end of Bridgeport about those older houses, and they were painted with the lead paint, and to let them know about the remediation opportunity through the health department, where the health department would provide a grant for them to, you know, get rid of that lead paint the proper way and, you know, get the safe paint. What percentage do you think at this point on the East End, or what percentage of families are still living in those old homes with the lead paint?
High. It's still high only because we don't really know if you're under 6 years old. That's when we identify because of the children, right? Because children tend to put everything in their mouth. They're exposed to the paint chips, the dust, stuff like that. But it's pretty, we have a high rate in the city of Bridgeport and in the state of Connecticut as well, New Haven, but Bridgeport does have a high lead level. And the state is actually going to be reducing their numbers to 5 and above, which really makes more of an intervention than we currently have at 10, which is great because now we can get to it sooner. Because one of the consequences of lead poisoning for children is the cognitive development, right? So sometimes there is irreparable damage that can't be come back from if there's a high lead exposure. And so the sooner we can identify lead within the property, the sooner we have our inspectors go out. And now the Department of Public Health has actually allocated some ARPA funding through the Connecticut Children's Hospital of any property owner, whether you're renting or owning, and you have lead exposure in your home, you have lead pieces in your home, there is a grant as well. You know, you apply for it and they will, if you qualify for it, they will then help you find a Connecticut licensed lead abatement individual, and they will help with the costs of cleaning the lead from your home, which is important because we really want to make sure that children are safe. The percentage I don't have, I'll be happy to look for that, but I do know that the numbers are still rising, unfortunately.
Okay, thank you. Okay, going to the chat from Valencia. Thank you, Dr. Rodriguez, for sharing your story. Your passion and commitment to service is commendable. What inspired you to pursue a career in health, and who are your role models?
The easy answer, the role model is my parents. Like I said in the beginning, my dad was a custodian, fancy name for janitor today, right? And so he had always said to me, back when he was in Puerto Rico, you know, they couldn't go further than high school because it just wasn't affordable for him. And so he's like, you know, you got to get education because you have to be better than this. I don't want you cleaning toilets. Not that it's bad, right? But he had a different vision for his family. And so the reason why I wanted to be in health was I was always curious about how things happened. I was curious about how babies were born. I was curious how people with diabetes and heart disease, how were they treated and how did they get better? And that sort of began my interest in healthcare. Once I became a nurse, I did have this phenomenal nurse manager. She ended up really being my role model and said, you know, you're wasted here and you need to go further because there's just something about you that has to go further. And so she saw something in me that I really didn't know. And so I took that and ran with it. And so teaching is also something that I love to do. And I was able to teach for a year at the University of Bridgeport in their School of Nursing until the opportunity came to be the chief nursing officer at Optimus, and then got promoted to chief operations officer, and then now as a health director. But it's always been about giving back to that community, giving back to those that needed it the most, that can't. And I wanted to be that voice for those individuals.
Okay, thank you so much. Next question is from our board member, Dr. Immaculate Khan. As the executive of the Public Health Department and a doctorally prepared RN, how do you see the role of nursing evolving in addressing public health challenges, especially in terms of legislative policy advocacy?
I think it plays a phenomenal role. It's very critical, right? Because for the moment, the public health nurse is really not something that is taught very well in academia. And that was the first thing that I saw. Not to knock it because I love it. I was a hospital nurse as well. But the public health nurse really is at the forefront of a lot of prevention as opposed to reaction. And it's actually educating the community about what are the positives and what are the negatives within our community and how that negativity could impact our health. From a legislative policy piece, it's really important for us to identify what are some of the challenges and then bringing that nursing community, because there is a Connecticut Association of Public Health Nurses, and they're very active within the state and within our communities. But policy, a lot of nurses don't have the experience in that, Dr. Khan, and so we need to do a better job of that. And I'll be happy to have a conversation with you about that, because that's something that I'm looking towards for policy change, at least here within the city, not only a local aspect, but how can we leverage at the legislative body some changes from a public health sector. And a lot of my colleagues from the director of health standpoint also look at policy as a big thing as well.
Okay, thank you. Next question is from Josue. You reference partnerships with healthcare providers like Bridgeport Hospital and community health centers. How do you envision expanding these collaborations to further improve health services in the community?
You know, the main thing with the hospitals, they are not-for-profit, they're community-based, right? And so Bridgeport, as well as Hartford Health, we all know it's still at St. Vincent's, so forgive me if I keep calling it St. Vincent's. They've always been entrenched within the community, right? They do also provide services that we can't. Some of it could be specialty cardiac, neurology, dermatology, certain specialties that the average individual may not be able to get access to. So it's really identifying who within that organization is a phone call away to say, hey, Josue, I have a patient who needs to see the cardiologist. Do you have something available, right? And then the community health centers, they're federally funded, they're federally qualified. They do offer a multitude and a range of health services at a more affordable rate. It is usually based on a sliding fee scale. So based on your income level, will usually dictate how much you can pay for a visit. They do have relationships with Quest Diagnostics. So we kind of bundle, and I say we because when I used to work there, this is how I know, we would have bundle packages with the laboratory to get your blood work done, right? And so from a health department standpoint, we also serve for those that cannot serve themselves. And so that's in the sense of tuberculosis. We have a lot of refugees that are coming from other countries, other islands and stuff that have tuberculosis, whether they're active or latent TB. It is the health department's responsibility under state mandate to take care of them, as well as anyone with sexually transmitted infections. And we don't deny anyone based whether you can afford to pay for it or not, right? So we do as much as we can, and then we expand that collaboration with the federally qualified health centers and the hospitals to tap into their resources for our community. Because sometimes they do offer free services as well, or free care applications. It's just really knowing what services they provide to tap into that.
Okay, thank you. And this question is from Layla. Thank you, Dr. Rodriguez. Your story and work is inspiring to me. How can we, as members of the community, increase outreach within the community of the effects environmental factors has on individual members' health outcomes?
Well, let's talk, right? I would love to set up some initiatives. It's all about health education, whether it's creating frequently asked brochures, or my staff and I really love to do a lot of Facebook Lives and getting that information out there. I'm happy to deliver whatever message, or you and I can chat about how we can do it from a community perspective. Because one thing I've learned is also to reach the children. When you get the children first and you get them to hear and listen to you, they get the parents to hear. And I say that because when my son was in school and they were talking all about COVID and they were giving out the free test, my son came home with like 6 of them. He goes, "Mom, look." Little did he know I had a case of it myself, right? But he was so excited to hear what the government was doing, of what the schools were doing, and how we were trying to decrease the transmission, that he forgot who I was, right? And so I just listened with this rapt attention because he understood. And if he can explain it to me, then I got it. And that was my light bulb moment to say, if I can get children involved in a lot of the education and to understand the challenges and how they can be a part of the solution, they can then get the parents on board, because the parents will listen to the children when they have a vested interest.
Okay.
Thank you so much.
Another, oh, I'm
I'd love to
sorry.
connect offline. Thank you.
Another question from Dr. Immaculate Can. What do you believe is the most significant impact nurses can have by getting involved politically? How can we encourage more nurses to step into leadership roles in shaping healthcare policy?
I think it's being transparent in what we do, right? Because again, I can't speak for everyone, but I know before I started teaching nursing, it was all about the hospital, very little community engagement. But you have community nurses, which are a little bit different than public health nurses, but we still serve the same community. You have visiting nurse services, and I think it's bringing them into the conversations. I think it's meeting them at their associations and organizations and meeting, and letting them know that their voice is just, if not more valuable, because they're seeing it from the boots to ground perspective. This was very apparent during the 9/11 events that occurred, right? Because the hospitals were inundated. It was all about public health, and how did the public health nurse respond to these emergencies, right? We were seeing it first before they were transported to the hospital for care. And I think it's just educating our nurses to say, your voice matters. You have a different perspective on what's occurring within your own community, that you should be a part of that conversation, right? When I come to work every day, I have what I call 3 lenses. I have the lens of the nurse from a healthcare perspective. How can I take care of my staff and my community on a day-to-day basis, irregardless of my clinic, right? So I look at it from a healthcare perspective. I also look at it from a public health perspective, right? So that duality of how do I bring that into the community? But then I also look at it from a business perspective. How do I build that relationship? How do I find grants? How do I find funding? How can I work with someone that has a grant that can bring a program that can serve our community, right? So your voice matters, your knowledge matters. And I think that they haven't really been afforded the opportunity to speak about it. And so that's something that we should change from a nursing perspective. Every voice counts, irregardless of where you're working and in what field of nursing you're working in.
Okay, thank you. And I see Wendy may be gone. I see where she had made a comment that her son was sick from the paint and she had to move out of her old apartment, but now he is good. And, I learned so much when I was educating the residents about lead paint, because we see so many of our Black and brown kids and we think, oh gosh, why can't they learn? Well, what's going on? Why can't they keep up? with other kids. And, many of them were exposed, to that lead paint. So it really affected their ability to learn at the level of other kids who were not affected. We're getting ready to close out. Is there anyone who have a question? Or I don't think I skipped any in the chat, but did anyone have a pressing question before we go
For you, Wendy says, right now I'm a rent, but I would love to know about Habitat. How does it work?
Yeah, so Valencia put something in the chat. Valencia is the director of family services. So she did go ahead and put her information. And, certainly we'd love Wendy to, share the information with you and how we can get involved in this process. I have to share this. At our last home dedication, it was so touching. Valencia, would you like to share about the family and the son? And it was just, go ahead.
Sure. So many of you may have been there, but sorry, please forgive me. I'm a little bit under the weather. However, what was amazing about the dedication, the home was actually on the East End, Dr. Rodriguez. It was on, or it is on 983 Cassuth, not far from McGivney. So what was interesting is that the future the homeowner, she didn't tell her son about purchasing the home. And it was super cool, so nice. The tears were flowing. It was just so wonderful. When he showed up, that was the first he had learned. And our board chair, George, along with Carolyn, was there to, greet him. And he had an opportunity to tour the home and said he was just grateful and he was excited to have his own room. And it was just amazing, 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 amazing. Since I've been here for 3 years, we've never had a dedication like that. It was just something for the record books, I would say.
And Valencia, the process that mom went through, was that about a year with the classes helping to build her house?
Sure. So what I will let you know, Dr. Rodriguez, in order to qualify for a home, you need to be able to afford the home, which we would not charge you no more than 30% of your income, A. B, willing to partner with us. That's through the partnership equity hours in volunteering. And then C, of course, be able to willingness to partner. Willingness to partner. I'm having a brain fog. Bottom line is she fulfilled all of that. And she was able to finish her hours in record time. She was approved in spring of 2024. I'm going to say maybe March. And she just recently dedicated, and we'll be sitting across the table within a week or so from the attorney, and she'll be closing on her home.
That's awesome. That's awesome.
So go ahead.
The next dedication is actually on Stratford Avenue, and that's on October 26th. So please come by. We would love to have you join us.
The invite, I would love to go. A friend of mine, the Habitat home on Pembroke Street, one of my staff.
Yes.
And Ramon Jimenez years ago was one of the first ones who also had a house as well. So it's a beautiful thing, and people just love to have that opportunity just to own, and then you help build it, which is even more of a pride thing that I built this home, right, with my own.
Yeah. So what was really cute about the son, we had a banner on the house, so there's a picture on him and his mom. And so when they arrived, he walks over and he goes, "Why is my picture up there?" Because he just had no clue that his mother, was getting this house for the family. So it was really touching.
Xavier, and the fact that she was able to surprise him. Not even her own dad knew about.
There you go. That was me. Sorry.
No, I'm hearing someone, but I couldn't see who. Okay, so at this time, I'd like to ask Dr. McLacan to, say a few words on behalf of the board. I'm so happy to have her, and also Beth Rafferty, another board member here today. So Dr. Can.
Thank you so much, Madam CEO, Dr. Carolyn Vermont. This is really incredible. You are doing such an amazing job at Habitat, really raising awareness in so many levels. And as you can see today, I was so excited to see a nurse conducting this presentation. And at that, as a minority myself, a minority nurse conducting presentation, which, the way we serve the community and the work that we do, it's so important, for us to highlight, the issues that are impacting, our communities. So Dr. Rodriguez, you did an amazing job. And I speak on behalf, I could say I speak on behalf of the entire board of Habitat, which I proudly serve. But today, I also invited many of our nurses here from Silver Hill Hospital. I'm the chief nursing officer here at Silver Hill. And when I saw a nurse was conducting this, I have my right hand, Peggy Sawyer, here with me, and many other nurses. There's a few other nurses. Tamatia is here. But thank you for your inspiring presentation. So you're getting a lot of invitation. You got one from Miss Goodwitch, and you're getting one from me because I am very active with the Connecticut Nurses Association. And one of the things that I'm very passionate about is policy. Nurses to be at the table, nurses to be really having a voice, an impact, nurses running for office. And I invite you to please be part of the Connecticut Nurses Association if you're not. And if you're not, I'll find you and I'll drag you. And we're all a team, and we need more nurses at the table and for the work that we do, so that we could really improve our community. So I appreciate you. I appreciate your hard work, and I'm just really full of admiration of the work that you are doing. Thank you so much.
Thank you so much, Dr. Can. And one of our partners, Bridgeport Hospital, Martha, would you like to just share what you wrote in the chat?
The East End NRZ will be holding a Cancer Awareness Day, their third annual Cancer Awareness Day on October 26th. You said October 26th, and that rang a bell. So 10 a.m. to noon, it's an outdoor event outside of the Baker Funeral Home. We're hoping to have a speaker address prostate cancer. I'm still working on that and confirming details. Thank you.
You're welcome. So everyone, on the 26th, you can go there first at 10 o'clock and then come right across the street for our home dedication at 12 noon. So you can just make it a few hours there on the East End, celebrating our community, health, and housing. Dr. Rodriguez, thank you so much. I second everything that Dr. Can said. This was such great information. Information that we need to hear. We always say in our community, what's the saying? Health is wealth in our community. We're urban Bridgeport. We have so many wonderful things that are going on. But we also have to face a lot of challenges, and, health, equal access to quality health care. And so many of our families that come to us, they're living in substandard housing, and the kids are exposed. Their asthma is acting up because there's mice in the house and mold. And, I'm just grateful that we're in a position here at Habitat, to provide brand new homes for these families. So thank you. We're in this together, all of us. We're partners for a better community, a healthier community here in urban Bridgeport and greater Bridgeport, Fairfield County. We're all doing all that we can to make it a better place for our residents. So thank you again. I see Martha's comment, Dr. Rodriguez, you're a wonderful inspiration. Thank you. And that's from all of us. I see from Andrea at Bridgeport Landing. Bridgeport Harbor, thank you very much for this informative presentation. So just again, thank you so much. And I see where our communications director said a picture before everyone leaves. So is this a good time for all of us to smile? I'll take my glasses off so there's no reflection.
Yeah, right, no glare.
Okay.
I said I better let people know to smile instead of just randomly capturing a moment. All right, so ready? 3, 2, and 1. Got it.
All
Thank-
right. Thank you so much, and for all of you. It's lunchtime. You could have been doing anything else, but you're here. So thank you for spending this hour with us. It's greatly appreciated.
Thank you.
Okay, take care.